birthday. Can you go ahead and tell me your full name and birthday?
Penick, and 32503.
Okay. Hi Colton. Today we're going to be doing a head-to-toe assessment on you, and the first question I'm going to ask you is I'm going to determine your level of consciousness. So go ahead and tell me your name again.
Colton Penick.
Where are we right now?
In the hospital.
And what year is it?
2020.
And what are we doing?
A assessment.
So you're alert and oriented times 4. And I'm looking at your general appearance and you appear well. You don't appear ill at all. So we're going to go ahead and get started, and the first thing I'm going to do is your skin, hair, and nails assessment. So I'm just going to have you sit up for me, and I'm going to look at your skin. Okay, I'm looking at your skin and it looks pink. It's warm and your skin is dry, okay? I don't notice any lesions. I'm going to check your trigger. Good. Okay, you have good mobility. I'm also going to look at your mucous membranes, and I notice that your lips are pink and your eyes appear moist and not too dried out. Okay, so I think that's everything with your skin. Now I'm going to check your nails. I'm just looking at your nail beds and making sure they're intact, which they are. And for your hair, I'm just assessing that your hair is present, it's evenly distributed on your head, bilateral arms and legs. So now we're going to go ahead and move on to your cardiovascular assessment. And the first thing I'm going to do is check your pulses. I'm going to check your radial pulses bilaterally, or 2+ pulses. Then I'm going to check your post-tib pulses bilaterally. They're 2+. You also could check your dorsalis pedis. You can do either one. While I'm down here, I'm checking for edema, which he has none. Okay, and the next thing I'm going to go ahead and check is your capillary refill of your nails. It's less than 3 seconds bilaterally. And now I'm going to check your heart tones. I'm going to start with my diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. Now I'm going to switch to my bell, and I'm going to check for murmurs. Good. Now I'm going to go ahead and check your respiratory assessment. And just by looking at you, I notice your work of breathing is normal. Your breathing is not labored. You have good posture. I'm going to check your, first I'm going to palpate your interior surface and posterior surface for tenderness or crepitus, any tenderness?
No.
Okay, no crepitus was noted. Now I'm going to check your lung sounds. I'm going to check 4 in the front. Big deep breaths. Blow out. Big deep breath. I'm going to check lateral. Go ahead and lift up your arms for me. Big deep breath. Big deep breath. Okay, can you switch to the side a little bit? I'm going to go ahead and listen to the back of you. 8 in the back. More. Good job. Lung sounds are clear bilaterally, anterior and posteriorly. Next thing I'm going to check is your abdomen. I'm going to go ahead and have you lay down for me. So I'm just going to look at your stomach here. I'm looking at his skin. His umbilicus is centrally located. His skin is intact. I don't notice any scars or lesions. Now I'm going to go ahead and listen to all 4 quadrants. He has bowel sounds in all 4 quadrants. Now I'm going to go ahead and do a light palpation. Any tenderness? I'm not noting any abnormalities, masses, anything like that. So we're going to go ahead and have you sit up. Next thing I'm going to do is check your musculoskeletal. So I'm going to have you stand up and walk to the camera and back. He has a good steady gait, no worries there. His arms are symmetrical. Go ahead and have a seat. Then I'm going to check his bilateral strength in his lower extremities by having him do dorsiflexion and plantar flexion. So go ahead and push the gas pedal, plantar flexion, pull toes to the nose. Good, he has bilateral equal strength in his lower extremities. And then the last thing I'm going to do is check your HENT and neuro assessment, okay? So HENT, we're going to do that first. I'm just looking at your head and neck. It's symmetrical, no lesions, bruises, any of that is noted. No injuries. Eyes appear clear, no drainage. Ears are symmetrical, no drainage through those either. And you also, by our conversation, you can hear me just fine. Nose is symmetrical, no drainage there either. And now I'm going to go ahead and look at your throat. I want you to say ah.
Ah.
Okay, he is moist and pink. He has good dentation, no foul odor. Can I see under your tongue? So we have good oral hygiene. He has braces on and no lesions noted either. The last thing I'm going to do is your neuro assessment. I noticed again that you have good clear speech and you're alert. I'm going to check your cranial nerves. And in that is going to be the Perla assessment. So we're going to go ahead and do 2 first. So if I had a Snellen chart here, I would have him do that to check his visual acuity, which I don't have, but of his cranial nerve number 2. But I am going to have you watch my pen. We're going to check his confrontation, which is intact. So 2 is intact. Then we're going to do 3, 4, and 6. Right now I'm looking at your pupils. They're equal and round. Now I'm going to shine a light. They are reactive to light. Now look behind me at that eagle picture and then look at me. Look at the picture, look at me. So his pupils are equal, round, reactive to light, and accommodate. So 3 and 4 are intact. Last one I'm going to check on this is number 6. I want you to watch my pen and we're going to do 6 cardinal gazes. Okay, good. Those are intact. 3, 4, and 6 is intact. Now I'm going to have you close your eyes, and when you feel me touch you with this cotton ball, say yes.
Yes. Yes. Yes. Yes.
So 5 is intact. Next we're going to do 7. Look at me. Raise your eyebrows. Close your eyes tight. Puff out your cheeks and smile. All of those movements are symmetrical. So number 7 is intact. Number 8, just say yes when you hear my fingers. Do the whisper test.
Yes. Yes.
Okay, good. Number 9, go ahead and say ah.
Ah.
Good. His uvula goes up and down. His gag reflex is intact. Now go ahead and swallow. Good. Number 10 is intact as well. Now I'm going to put my hands on. Shrug. 11 is intact. And 12, stick out your tongue. Side to side. Okay, so 12 is intact as well. So that completes everything on our head to toe assessments. And you, everything checked out good and your assessment was normal. Do you have any questions for me?
No, ma'am.
Okay, thank you for your time.
Thank you.
Make sure I didn't miss anything.